I'm just talking to the one slide, just summarising some of the opportunities of the grant scheme, particularly from a kind of a provider point of view. I think we feel it creates an exciting opportunity for mental health providers to work collaboratively with the third sector and community groups. There's an awful lot of expertise, knowledge and resources out there, but currently the way services are configured, there's a lot of silo work that goes on, so this is a real opportunity to work together to deliver some really good outcomes. Secondly, it makes it easier for all parts of the community to access support for their mental health, particularly within the IAP service, the service I work in. I'm quite aware that we've got quite a number of underrepresented groups coming through using IAP services. So people from BME communities, people with language needs, gender, we get a lot more women rather than men accessing the service. Age range, we get a lot of people from the kind of middle age range accessing IAP, but not so much people around the 21 age range or above 61. LGBT population and people with disabilities, particularly people with moderate learning disabilities, but also physical disabilities and long-term health conditions. It's an opportunity to test out new methods of delivery, looking at targeting populations, evaluating and really having an opportunity to look at best practice and coming out with some shared outcomes and using that to inform future commissioning decisions around how services can be structured. It's an opportunity to give voice to service users. As providers, we try to engage with service users about how they think services should be developed, but I think the third sector and community groups are quite often more closely aligned to the communities and can engage service users a lot more better than perhaps we have historically. So it's an opportunity to give voice to service users more. And also to create new pathways. I think kind of statutory services tend to have quite very rigid entry points into services. So it's an opportunity to create multiple doors for support. So trying to create new options for people to access services. Also looking at integrated support, looking at possibilities around co-locating to deliver interventions, sharing of clinical information and actually doing some collaborative care planning rather than working separately within organisations. And finally, it's an opportunity to, as Jay mentioned at the start, in terms of parity with physical health care, mental health services nationally is considerably underfunded, so it's an opportunity to actually look at what the mental health needs are of the community and actually work a little bit differently with the community.